It's a quiet Tuesday evening. John, a retired history teacher, settles into his favourite armchair. Suddenly, a crushing weight slams into his chest. Pain shoots down his left arm. He's alone, and cold panic starts to creep in. But through the fear, he remembers a handful of simple, proven actions that could buy him the precious minutes he needs. This is what he did. Heart attacks are terrifyingly common, and many people are alone when they happen. It's one of our deepest fears, for a reason. But what if you could change the odds? What if knowledge could be your first responder? The science is clear. The actions you take while waiting for help can dramatically increase your chance of survival. Before we get to our countdown, one thing stands above all else. Call 911 immediately. Don't second guess your symptoms. Don't try to be a hero and drive yourself. Every single second your heart is deprived of blood flow, that muscle is dying. Paramedics can start treatment the moment they arrive. So, like John, the very first thing you do is grab your phone and make that call. Once help is on the way, it's your turn to be your own best advocate. Here are the 7 actions that could save your life. The cough CPR myth. You've probably seen it on social media. A post telling you to cough repeatedly to stop a heart attack. This is called cough CPR, and it's a dangerous piece of misinformation. Major health organizations like the American Heart Association do not recommend this. It is not a treatment for a heart attack at home, and it won't restart a heart that's stopped. While it has been studied in very specific monitored hospital settings for certain heart rhythm problems, using it on your own during a heart attack is ineffective and can be harmful. Stick to the proven steps. Don't waste precious time on myths. Be your own doorman. A new thought hit John. What if they can't get in? It's a simple, terrifying problem. A locked door can cause a disastrous delay for paramedics. With careful movements, John made his way to the front door and unlocked it. He also secured his dog in the back room to make sure the EMTs had a clear, safe path. This one small action eliminates a huge, potentially fatal roadblock. Don't let a simple lock stand between you and the help you need. Prepare your handoff. During a heart attack, your brain is starved of oxygen, making it tough to remember things like medications or allergies. This is where a little prep work pays off big time. John had a bright, easy-to-read card on his fridge with his address, emergency contacts, medical conditions, and medications. He grabbed it and placed it on the table by the door. When the paramedics arrive, you want to hand them this vital information instantly. No struggling for words, no trying to remember dosages. You're giving them the cheat sheet to your health, saving them time and helping them treat you faster. The right way to take aspirin. John's mind cleared a little. Aspirin. He remembered the advice, but more importantly, he remembered the trick to making it work fast. Most heart attacks are caused by a blood clot. Aspirin is a blood thinner that helps stop that clot from getting bigger. But don't just swallow it. The key is speed. Chewing a 325 mg uncoated aspirin allows it to absorb directly into your bloodstream through your mouth, getting to work much faster than if you simply swallow it. John chewed one tablet thoroughly. Unless you're allergic or your doctor has told you otherwise, this simple action actively fights the cause of the attack. It's a non-negotiable step. Look, the knowledge you're gaining right now is power. These are the details that turn helplessness into action. If you're finding this valuable, do me a quick favor and hit the like button and subscribe. Every click helps this life-saving info reach one more person who might be alone and scared, just like John. Find your power position. Now that he'd called for help and taken aspirin, John's next job was to ease the strain on his heart. He fought the urge to pace or lie down flat. Instead, he got into what's known as the cardiac position. He sat on the floor, leaning his back against a wall for support. Then he bent his knees up, keeping his feet flat on the floor. This position does 2 amazing things. It uses gravity to make your heart's job easier, and it helps open your chest, making breathing easier too. John also loosened the collar of his shirt. It's a position of calm control, telling your body to conserve energy while you wait. Breathe your way through panic. Panic is the enemy. It makes you take shallow, rapid breaths, which only makes things worse by starving your already struggling heart of oxygen. John closed his eyes and focused on one thing, his breath. He started a simple, controlled breathing exercise. Inhale slowly through the nose for 4 seconds. Hold for a few seconds. Then exhale slowly through pursed lips for 6 seconds. This technique helps you override your body's panic response, reduce the strain on your heart, and keep your blood as oxygen-rich as possible. With every cycle, John felt a little bit of control return. He wasn't just a victim anymore, he was an active part of his own survival. Light the way. The paramedics were on their way, but how would they know which house was his? John knew that every second counted. After unlocking his door, he did one more thing. He turned on his porch light and hung a brightly coloured kitchen towel on the front doorknob. It's a simple, unmissable signal that says, "Help needed here." Some people even keep a whistle by the door to help responders pinpoint their location inside. John had just turned his home into a beacon for his rescuers. Use your secret weapon if you have it. John had one last tool in his kit. His doctor had prescribed nitroglycerin for chest pain, and he knew exactly how to use it. First, a huge warning. Only take nitroglycerin if it's been prescribed to you. Never, ever take someone else's, and do not use it if you've taken erectile dysfunction medication recently, as the combination can cause a fatal drop in blood pressure. John knew the drill. He sat down, as it can cause dizziness. He placed one small tablet under his tongue and let it dissolve. This medication works by relaxing your blood vessels to improve blood flow to the heart. He noted the time. The protocol is to take 1 dose, and if the pain has not improved in 5 minutes, you can take a second dose. A third dose can be taken after another 5 minutes, but you should not take more than 3 doses in 15 minutes. As the medication began to ease the pressure, John heard the distant sound of sirens. The paramedics found John unconscious, sitting by his unlocked front door, medical info in hand. He had been his own first responder. He took a terrifying, chaotic event and systematically took back control. By calling 911 first, and then following these actions, he gave himself the gift of time, and the best possible chance at a full recovery. So let's quickly recap the 7 life-saving actions to take after calling 911. Number 7, unlock your door. Number 6, get your medical info ready. Number 5, chew one 325mg uncoated aspirin. Number 4, get into the cardiac support position. Number 3, control your breathing to stay calm. Number 2, signal for help by turning on your lights. Number 1, if it's prescribed to you, use your nitroglycerin correctly. These aren't just good ideas, they are proven actions that save lives. Your life, or the life of someone you love, could one day depend on remembering them. Please share this with your parents, your friends, your neighbours, anyone you know who lives alone. This knowledge you share could be the most important gift you ever give to them. Subscribe for more essential health and safety information. Stay prepared, stay empowered, and stay safe.